So finally, what do you recommend for parents how to cope with fever?
I recommend, as with all challenges in life, to first ask, what could this be good for? What positive aspects can we gain from this adventure? And we know from immunology that there are a lot of things that this could be good for. We know from psychology that there are a lot of things that these could be good for. Could be good to nurture my relationship with the child. So that's the first thing. The second thing is to realize that the fever in itself is, in the case of acute infections, a friend. That the fever will not rise to temperatures that are dangerous. There is no case in the literature that I know of where the fever of itself in a healthy child or in a healthy person causes damage. And that's very important to know, that the fever will rise to a certain level, and then there are a multitude of the body actually causes the fever to rise. It's an activity of the body, and then it counteracts this fever and makes sure it does not rise to levels that are dangerous for the brain. And it's further important for parents to know that some young children, between the age of 6 months and 6 years usually, about 6% of all children, will have febrile convulsions due to fever. Now that is something that has fueled the anxiety towards fever. And it's very important to know that we cannot prevent febrile convulsions with paracetamol or ibuprofen. We cannot prevent febrile convulsions by lowering the temperature. They usually happen while the temperature is rising anyway. And later the child can deal with much higher temperatures without having a convulsion. The good news is that febrile convulsions are not dangerous. They do not cause long-term sequels, long-term damage to the brain. So even if the child has a febrile convulsion, you just have to hold the child, even though it looks terrible, it looks as if your child is dying. You will call the ambulance just to make sure that your child is okay by the time they come. You will hold your child. If your child is vomiting or drooling, you may want to lay them all on the side so they don't choke on anything. In the knowledge that this is not dangerous for your child. The other thing to know is that fever, although it's a friend, could be the reaction against something that is not a friend, like meningitis or a febrile infection of the urinary tract, of the kidneys, or a severe pneumonia. So you need to check with your doctor to see whether this is dangerous or not. But children who have something dangerous look as if they're not doing well. So if your child has a fever and looks pretty fine, you can relax. But if your child looks bad, if their consciousness has changed, if they're looking as if they're really suffering, if they have no body tone, then you will want to see the doctor quickly. And if not, you actually always have time, except if your child is very young. If it's under the age of 3 months, then fever is an indication that there's something going wrong. And the higher the fever, the more is going wrong. That's not true later in life. There's no correlation between height of fever and how serious and how wrong what you have is. But for small children, yes. And that's where you always need to see the doctor on the first day if you have a very young child. And with that knowledge, the parents can learn to deal with fever in a way that helps the child feel relaxed with what they have. And that will help them deal with what they have in a better way. And that is what I would wish to happen instead of over-anxious reactions, overuse of antipyretics, overuse of antibiotics, which don't help in viral infections anyway, and a much too high stress level in many of the parents who we see.
Fever is a friend. I think that's a wonderful metaphor. Dr. Martin, thank you very much for this interview. And for our spectators, if you want to learn more, you find more information just below the video. Thank you.